I'm here today with Dr. Johnson, who's a professor of medicine at the University of Colorado, and I've got him on this interview today with you, for you, because he's done quite a bit in helping uncover lots of information about a crucial and important topic that's really a major contributor to chronic degenerative disease in our country, and that is the high fructose corn syrup and fructose in general. So I'm going to let him discuss with you some of his professional accomplishments, so that can frame the information that he's going to be discussing. So, Dr. Johnson, can you tell us a little bit about your professional experience?
Thank you, Dr. Mercola. I'm very pleased to be on this program. Yes, we've been studying the effects of fructose on the metabolic system in animals and cell culture, and even in clinical studies over the last number of years. And most of our research is focused on how fructose might cause obesity, high blood pressure, kidney disease, fatty liver, and other problems. So it turns out that most of the fructose that we are exposed to is coming from added sugars, such as high fructose corn syrup and table sugar.
Now, you're a physician, and I'm just a little bit unsure about what you're doing with respect to. Do you have an active practice? Do you do research? Do you do a combination of those at the University of Colorado?
Yeah, I'm a professor of medicine here at the university. I run the kidney division, and I also we're in charge of high blood pressure research and also transplantation. Most of my work is involved in research, probably about 70%. I do see patients as well, and I do a lot of teaching. I have a textbook, which is a very popular textbook in my specialty of kidney disease.
Well, I'm really intrigued as to understand how a professor of medicine in a traditional conventional medical setting would have an interest in this topic, and then go and really take the initiative to do the additional research that you did. So what motivated you, inspired you to take this path?
Well, we've been very interested in the pathogenesis or the cause of high blood pressure. As we worked on that, we discovered that a substance called uric acid, which is normally is in our blood but can vary dramatically in the amounts, could actually, if we raised it in an animal, could actually cause high blood pressure through this mechanism. And much of our work is focused on how uric acid may cause high blood pressure as well as other conditions in the body. Uric acid is normally associated with the disease gout, but it's been known for a long time that people with high blood pressure or people who are overweight or people with kidney disease often have high uric acid as well. And usually it was thought that the uric acid was secondary to these conditions and not the cause.
In your research, have you uncovered any threshold levels of uric acid that might suggest that one's at a particularly high risk of developing these diseases? I mean, or is there a healthy range that you advise people to maintain?
We find that when the uric acid gets up around 5.5 milligrams per deciliter or higher, it is associated with an increased risk for the development of high blood pressure and diabetes and obesity and kidney disease. And when we took animals and we raised uric acid in the animal, they developed high blood pressure. And they also developed other features associated with inflammation.
Excellent. And then how did you uncover this association? Is this something that you became aware of through reading the literature, or is this just the clinical interpretation? Are you one of the pioneers in recognizing this disease?
When we found that if we raised uric acid in animals, that they developed high blood pressure. We then looked in people, and we found that newly diagnosed high blood pressure is associated with an elevated uric acid in adolescents 90% of the time. And then we did a clinical trial in which we lowered uric acid in obese, hypertensive adolescents, and we actually normalized blood pressure in 87% of adolescents simply by lowering the uric acid to less than 5 milligrams per deciliter.
And how did you lower the uric acid? Was it with something like allopurinol, or did you do it through dietary measures?
We did it initially with allopurinol. And since then, we've done several other studies that are also positive, And we are now working with the National Institute of Health and have just submitted a very large grant, which will be multi-center study to see if lowering uric acid can help prevent the development of hypertension. It's a very exciting area. And what we think is that the uric acid raises blood pressure acutely, but over time causes changes to the small blood vessels in the kidney that then drive the high blood pressure, even though the uric acid may be lowered. So the uric acid is this like inciting event that causes changes in the kidney that then makes the kidney hold on to salt and cause persistent hypertension.
This is fascinating. I'm wondering if, with your correlations or the research you've done, how potent an intervention is restriction of fructose as relative to the administration of something like allopurinol and lowering the uric acid level.
Well, that's so. Let me get to the next step because you're going there. So then, when we realized that uric acid might be important in high blood pressure and kidney disease, we started looking at, well, what raises uric acid? At this, we found that, of course, it's been known that meats and purine-rich foods can raise uric acid. But it turns out that one of the most potent ways to raise uric acid is via fructose. And fructose is a sugar, but it's very distinct from other sugars like glucose or dextrose. When you ingest fructose, it is metabolized through very, very specific pathways that are distinct from glucose. And when that happens, uric acid is generated. So fructose actually generates uric acid within minutes of ingestion, and it increases inside the cells as well as it seeps out into the circulation. And in the last 3 centuries, there has been a dramatic increase. Just to give you an idea, in 1700, the average person was eating 4 pounds of sugar a year. By 1800, it was 18 pounds of sugar a year. By 1900, it was about 90 pounds of sugar a year. And today, about 1/4 of our population are eating more than 1/2 pound of sugar a day. So we're really seeing a dramatic increase in the ingestion of added sugars. Now, when I call it sugar, I'm referring to added sugars, which the 2 major sources are high fructose corn syrup and sucrose or table sugar. And both of these.
And for those of our listeners who aren't familiar, sucrose is a disaccharide composed of glucose and fructose.
Correct.
Yeah.
That's
so
correct.
50% of sucrose or table sugar, from cane sugar at least, is considered fructose.
Right. And the problem with both high fructose corn syrup and with table sugar is that there's no vitamins to counteract the fructose. When you eat natural fruits, you're actually eating much smaller amounts of fructose, and it's coupled with vitamin C and other antioxidants that actually block the effects of fructose. So natural fruits in general, even though they contain fructose, do not cause these kinds of effects. If you eat 1 or 2 or 3 natural fruits, you get the benefit of the antioxidants, and you don't really see too much problem with the fructose. Okay. On the other hand, if you drink a large super glass of apple juice and you drink it very rapidly, the sugar content is quite high. There's a lot of fructose, a lot of the antioxidants are lost.